at a time when the country was going through war, emergency, refugee influx, and food crisis. A young pediatrician from All India Institute of Medical Sciences, New Delhi, during his exposure to urban slums and villages, realized that malnutrition is more of a socio-economic and preventive phenomenon than medico-remedial. Dr. Shomir Chaudhary decided to fight child malnutrition at the grassroots level, and the battle is still on. From the refugee camp in Uganda to nutrition operation mission at Thai-Cambodia border, Dr. Shomir Chaudhary traveled to different continents as a consultant to learn from the situation and provide know-how to improve lives of children and women, and he could be somewhat helpful to somebody.
In 1974, when we started working here, this area was plagued with malnutrition and high child morbidity and mortality. Every second child was malnourished, and child deaths were very much closely linked to malnutrition.
It all started at a classroom of St. Vincent School at the southern fringe of Calcutta, with 3 people and a table, with almost no resource and no infrastructure. Just a Saturday clinic at the school premises, where most of the children used to come from the nearby Burma colony. Father John Heinrichs, a Belgian Jesuit who was engaged in a project called Green Triangle to support farming and combating hunger, assisted by Sister Pauline Prince, a Loreto sister and nutritionist. They supported Dr. Chaudhary.
So from that small clinic which dealt with malnutrition, we soon expanded to other issues like education and protection, because we figured out that the problem lay in the family, where if a child slips through the safety net, the child can become malnourished, the child can go out of school, and also the child can get trafficked.
Cine adopted a 1000-day approach of the life cycle. It is a very special approach to focus on mothers and children, and it is the time when most of the service providers can be involved, because they are responsible for the specific inputs in the life of a mother and her child. Only clinical support to the malnourished children was not sufficient. During mid-80s, Cine invented Nutrition Rehabilitation Center for critical care of the severely malnourished children and feeding practice of caregivers, especially mothers.
So our community approach of prevention started very much about 20 years ago, and since then, in the last 50 years, we have come a long way.
Cine, as a learning organization, gradually developed an integrated and holistic approach to ensure access to entitlements by the children, where the community takes responsibility, and that is how the Cine method evolved. It is a program which works very closely with all members of the community, the self-help groups, the government workers, the duty bearers, where community has to take more responsibility to make all programs successful. The Cine method is an approach to turn child entitlements into practice. It is based on various modes of Cine's interventions in partnership with government and other stakeholders made during last 5 decades.
Now we have expanded our activities to almost 6 states, covering women and children. We have gone into new areas which we have not dealt with before, such as mental issues. We also see child obesity instead of child malnutrition, and we also see the effects of climate change.
Apart from varied thematic area, Cine is now working at a vast geographical canvas, from the high hills of Himalaya to the Gangetic Delta, From unapproachable tribal villages of Jharkhand Plateau to the tea gardens of North Bengal, Cine serves 10 million people every year across 6 states of India. That is West Bengal, Jharkhand, Assam, Odisha, Tripura, and Madhya Pradesh. Cine extended support to the government functionaries to tackle natural calamities like tsunami, Aila, cyclone, and Bhuj or Nepal earthquake. During the recent COVID pandemic, Cine has been in the forefront in efforts to help distressed communities. In particular, it has run mobile and stationary kiosks to provide information to the community, sensitize the community on stigma related to COVID and related vaccination.
I'm very grateful that without the generous support of our donors, the government, the corporate sector, individuals, the international agencies, and our Cine support groups worldwide, we could not have reached this point of time. Also, I saw the deep passion and commitment of all our workers, now numbering more than 1,500, spread out in the different states, working in very hard to reach conditions with passion to improve the lives of women and children. We hope that with your support and with the passion with our workers, Cine will still remain relevant for the future.
Thank you.